All right, here we go. Is it your turn this week or is it mine?
Man, I don't think it's my turn. I'm pretty sure it's your turn.
Didn't I do the last one?
I don't know. Remember my last one? I can't remember exactly what it was about, but I'm pretty sure not me.
Okay.
Hey guys, why don't I just do it? Hi guys, I'm Dr. Gary Cervone. I'm the new chiropractor here at Cumberland. A little bit about me first. I am from Youngstown, Ohio, just kind of south of Cleveland in the northeast part of the state. I went to Youngstown State University where I majored in pre-med and chemistry. After undergrad, I decided to get into chiropractic, went to Palmer College of Chiropractic in Davenport. After that, I worked in Columbus for about a year, and then met Dr. House and Dr. Moore and really loved the environment here and decided to join their team. So I'm very appreciative of them having me in. Today, what we're going to talk about a little bit is some knee injury stuff, specifically meniscus injuries, and do they really need surgery or even an MRI at that point. So if this is something that you guys are dealing with, stick around and you'll learn a little bit about it. Dr. House is going to be my model here for me. So what the meniscus actually is it's kind of a little pillow that sits between this bottom bone in your leg, the tibia, and this top bone in your leg, the femur. And it acts as a shock absorber. So every time you take a step, you squat, you get up, you jump, all of that force comes up your leg, hits those meniscus, and it's going to kind of disperse so that that force isn't as strong as it goes up the leg. Now the meniscus is made of two parts, a very vascular outside, which a lot of blood flow gets to it, and a very non-vascular inside, which means not as much blood flow gets to it. Most tears kind of happen on that vascular outside where a lot of blood flow gets to it, which means they can heal. And typical signs and symptoms of these type of tears are some joint swelling around that area of the tear, a little soreness that tends to go away actually as you move more. So if you have some knee pain before you exercise and it gets a little better as you're going, that could be a sign of that. But those things do tend to heal. If we give them a little rest and you're getting treatment to it, we can get more blood flow to it, like with our laser treatments or some of the manual treatments that we do here. If you have a more significant knee injury, like you got hurt during a sports activity or a fall, that can damage that inside part where not as much blood flow gets to it, which means not as much healing can occur. And some typical signs and symptoms of that are some total joint swelling around the whole knee area, some deep knee pain, like you feel like the pain is just deep in the knee joint, and even some locking in the knee where you can't extend the knee all the way or you can't bend the knee all the way. And you might hear a typical little click or pop with some of these things. That tends to be a little more serious. That might be one where we need an MRI or a little bit of surgery to explore. So if it sounds like you have some of these signs and symptoms of the meniscus tears we're talking about, it's really important to come in and get that checked out right away as soon as you notice it, because letting these things linger can lead to other issues down the road, like early onset arthritis in the knee, even in the hip region as well. So come in, let us decide if it's one of those more serious tears that does need more investigating, or if it's the more common, not as serious tear that we can work on here. So what we're going to do is show you some of the things that we can do here to really help out with that. So first thing is, I'm just going to show you a couple exercises that will show you how to do at home that will prevent some of this from coming back. So one of the most important things when treating a knee injury is looking at the foot and ankle and the hip as well. The knee can only do what the foot and ankle allows it to do. So if I don't have good dorsiflexion at my ankle, my knee is going to take a lot more work there, which is going to put a lot more stress on that meniscus. So one thing we do at home is teach you an exercise on how to get good ankle mobility. So what this is called is the triplanar ankle exercise. We're going to kind of push into the wall here, and all we're going to do is take a step back, bend our knee, make sure it's directly over our ankle so we're getting that good ankle dorsiflexion, and come back up. We can even work side to side with some lateral movement here too. Take a step this way, making sure the knee is directly over the ankle still, and take a step this way, making sure that knee is directly over the ankle. So we're teaching the knee how to move properly while we're getting this kind of three-dimensional ankle movement. If we want to get some hip stability built into this too, we can also use the TheraBand to put around the knee and do this same exercise pulling on the inside, pushing out with your knee to turn on your glutes here to give you some hip stability. And we do the same thing, take a step back, knee directly over the ankle. So now we're getting ankle mobility, hip stability, and teaching the knee how to move properly all the way up the chain.
So as Dr. Cervone has said, if you've got knee pain, it's not really your job to decide whether it's a meniscus problem or if it's in the muscles or the kneecap. You got knee pain, that's one of our specialties. Come get it checked out before it kind of turns into other problems. That's really our mantra, and we're so excited to have Dr. Cervone with us because he's got the same excitement, the same abilities as we do. He's going to get a lot of patients better, faster. Thanks for sticking around.